Alcohol harm is a serious problem with far-reaching impacts on our nation's health, crime rates, social services and economy. We know that policy action is long overdue to curb rising rates of alcohol-related hospitalisations and deaths and improve the health and well-being of individuals, families and communities. But what does this look like in practice? And how do we get there? To drive meaningful change, we need a shared vision, clear targets, and a practical roadmap. That's why we brought together leading independent experts from alcohol policy, research, and treatment to agree a long-term plan for tackling alcohol harm. Using a structured research process called the Delphi technique that gathers and refines expert views, we developed a collective vision for a society where alcohol harm is rare and equal opportunities for good health and well-being exist for all. Experts agreed on 3 ambitious but achievable targets to measure progress towards this vision. Firstly, halve the prevalence of risky drinking over the next 10 years. Secondly, increase the proportion of people with alcohol dependency accessing specialist treatment to 50% within 5 years, and build capacity in the system for 80% to have access to treatment within 10 years. Thirdly, cut alcohol-specific deaths by 30%, returning to the pre-pandemic rate within 5 years, and subsequently to 2012 levels within 10 years. To reach these goals, we must change the environments, systems, and norms that shape alcohol consumption and harm. This means tackling affordability, availability, and marketing of alcohol, as well as addressing wider inequalities that exacerbate risk. It also means improving how the health and care system responds, with a priority on effective pathways between primary health care, acute hospitals, and specialist treatment and support. Our experts recommended a policy package with several key measures, including minimum unit pricing and a return to the alcohol duty escalator, introducing restrictions on alcohol marketing, empowering local authorities to regulate availability, increased and sustained investment in alcohol harm prevention and treatment, mandatory alcohol product labels, reducing the drink driving limits, and national and local guidelines for managing conflicts of interest. National polling shows that the public support action. What's needed now is political leadership to create a healthier, more equitable society. These changes and targets have been mapped into a visual roadmap to use as a key advocacy tool for inspiring and influencing change. This material is available on our website to download and share with local and national decision makers as a blueprint for achieving long-term progress. Use these tools to join us in calling for a society where alcohol harm is rare and equal opportunities for good health and well-being exist for all. For more information, please go to ias.org.uk.